I'm excited to now introduce you to our second lightning round presentation entitled Transforming Patient Outcomes, Advocating for Early Nutritional Integration. This session will highlight the critical role of early nutritional assessments, including their benefits and how to connect with a nutritional professional. For this session, we welcome Carmen Moore, who's a dietitian at Princess Margaret Hospital, and colorectal cancer program manager, Iris Carey.
Thanks, Anne-Marie, and thanks, Carmen, for being here today. So, Carmen, can you start by maybe telling us why nutrition matters during cancer treatment?
We know the foods that we eat provide the building blocks for our body's daily functions. And especially during treatment or with cancer, our body's going through a lot. Those nutritional needs get higher, whether you're on chemotherapy or immunotherapy, those drugs, or radiation side effects. Your body's going through a lot, and your cells are going to need more energy, and cancer cells themselves will also draw from your energy source. So we need to actually be mindful of increasing the nutrition that we're getting at that time as much as we can. By getting as close to meeting our nutritional needs, we can help manage energy levels, fatigue that might be related to nutrition or lack of nutrition, provide our body with those materials for replenishing the immune system and blood cells. We also really want to prevent and try to limit unintended weight loss, which is often muscle. It's not extra fat. There's no extra fat to be lost there. So altogether, getting enough nutrition can help improve our tolerance to treatment and help support a faster recovery.
Yeah. And so what are some of the ways that cancer and cancer treatment actually impact the body? So, what is that? You mentioned the impact on muscle loss, but is there also maybe a potential impact on the level of nutrients or minerals in our body?
Yeah, absolutely. So knowing that our nutritional needs are higher, part of that is because our body is using extra energy to deal with all the things that it's dealing with. And it's using our body's active energy as well as our storage energy, which can then lead to our body drawing nutrients from our muscles and our healthy body mass. So sometimes we'll also see in our blood work low nutrient levels like potassium, magnesium, iron, for example. It doesn't necessarily mean you have to focus on particular foods with those nutrients. The two big nutrients we want to focus on is getting enough protein for our muscle mass, which helps with mobility, immune system, and mobility. And the other big one is calories, which translates to energy in our bodies. So calories from eating enough would look like either increasing portion sizes if you're able. If you're not able, more frequent portion sizes, or adding foods with fat and carbohydrates. That would be what calories would look like. For protein, that would look like getting food sources from animal and plant-based protein sources throughout the day. So spreading it out and having them in different meals and snacks. Examples of protein foods would be meats, including red meat, seafood, poultry, eggs, dairy, nuts and seeds, and beans and lentils. Soy, such as tofu, is also included. If your body needs more protein or you're not able to get it from dietary foods alone, having supplements such as protein bars added into granola bars that have added protein or protein powder products can be another way to supplement. And in discussing with your team and figuring out what might be best suited and won't contraindicate your treatment, also nutrition supplements such as Ensure Boost are among the brands of products, drinks that are very nutrient and protein dense to support you on that journey.
Yeah. So considering all the challenges, that someone could face when they're diagnosed with cancer and going through treatment, could you walk us a little bit through how you might tailor someone's diet plan to accommodate specific symptoms like nausea, or, you mentioned loss of appetite, or even to changes to how food tastes? And then maybe even to, people that might be experiencing extreme pain or fatigue that could impact how well they're able to eat.
And that's why good nutrition during treatment can look so different for everyone, and there's no size fits all. Of course, we want to consider that the side effects, which side effects are impacting someone, how severely they're impacting you, and how well they can be managed are other things that can determine whether or not your nutrition risk is higher or lower. So some strategies will work for one person and it might not work for others, but I'm going to go over some of those more common nutrition impact symptoms, which is what we call the side effects that affect your nutrition. So I'll start with appetite, which is a really finicky one because a lot of people have it and it's hard to manage because it's tied to so many different other feelings you might have related around food. What might help is to focus on what works for you. So whether that's focusing on specific foods that you tend to gravitate towards, even if it's the same foods, even if you feel they're not the healthiest foods, they're helping you at a time when you're not able to eat as much. Another thing that's helpful is if food is not as appealing, to give it a bit of a framework shift. Food may become medicine for a while if you need it. And so focusing on making food something that's regular in your schedule, even if it's not the most enjoyable, and try to work around some of those tolerances and intolerances. So a side effect that can play into appetite would be nausea and vomiting. So another strategy that works for appetite that also works for nausea and vomiting would be choosing foods that work for you. So you might notice some foods are more of a trigger for nausea, or that after you eat it, it tends to make you feel sick. Maybe stay away from those foods for a little bit, see how you feel on another day. For some people, they might tolerate fluids, so things that require less chewing, more liquids. So choose liquids that are giving you calories, like juice or milk, nutrition supplements if need be. And if you're sensitive to smells, especially cooking smells or food smells, try to eat in a space or stay in a space that's well circulated, or open windows when food is being cooked, or choosing foods that are more room temperature so they produce less aroma. Using small amounts at a time might be less of a trigger. If you feel like when you eat a little bit of food and you already feel full, that could also bring on onset of nausea and perhaps vomiting. And this brings me to the next nutrition impact symptom, which is early satiety, which is another way to say when you feel full very often or after eating a small portion of food. So eating small amounts of food often throughout the day will help you add up those calories and protein to meet it at the end of the day if you add it all up. And again, if you find liquids are easier to digest and make you feel less full, then choosing liquids that give you the calories. I'm going to run through a few more side effects just because I know things like taste change, dry mouth, and pain, especially oral pain, would have an impact. So often if there is a taste change, anecdotally in my experience, I wouldn't say that I have evidence to back this up, but some people will say that they notice certain flavors taste disgusting, like whether it's like salty or sweet, and certain flavors actually are better tolerated, whether that be salty or sweet or sour. So I say maximize on that. Use those flavors. If it's sweet that you tolerate, don't feel guilty about using sugar or honey or syrup, flavors that will make the food taste good. You got to get the food in, so we got to make it taste good and as tolerable as possible. If you find some flavors are too strong, choose things that are a bit more bland. If you find some foods are too bland, add more flavor. So it's all up to what you're feeling and a bit of a trial and error. I've also gotten a lot of anecdotal comments about how meat tastes bad or metallic-y. If in general you have metallic-y flavor, it can help if you use plastic or wooden utensils, so something without that metal to it. Of course, it might not reduce the effect of it entirely, and if you find meat is still difficult to tolerate, don't worry, there are other ways to get your protein. Like I mentioned earlier, whether it's dairy, eggs, soy. If you tolerate the seafood and chicken, great. If you don't, look for other ways to get your protein in and use supplements if you need it. Another one that happens in the mouth is dryness in the mouth. So this can often come together with a bit of taste change. With that, it's because our salivary glands are not working as they were before. So using things like ice chips or hard candies to kind of stimulate that salivary gland action. And if you want to give some over-the-counter products a try, talk to your pharmacist. There are products available out there, whether they be gels or sprays that are artificial saliva sprays or mouthwashes that don't contain alcohol. Those will be the ones that don't dry your mouth and actually try to help give you that moistened sensation. Finally, maintaining a good oral hygiene. So cleaning your mouth regularly, more often throughout the day. Some people find benefit to using mouthwashes made from baking soda. There are some strategies out there. And then if you are having pain in the mouth, that could also really affect how much you're able to eat and even drink, and can really affect and lead to a lot of weight loss. So get ahead of that if you're able to. If you're having pain, speak with your team, any kind of pain anywhere. Speak with your team to manage it best. And I know there are some mouthwashes that are prescribed that some people might get to better manage the pain. So it's like a medication mouthwash that would target that in particular. If at any point you have issues with swallowing, definitely suggest you speak with a team. It may even involve another specialist in swallowing called a speech-language pathologist. And of course, if you have trouble with swallowing, it might mean you need to change the texture of your diet, whether it be softer or more sweet. The last thing I'll touch on, Iris, you mentioned fatigue, which is so pervasive and so hard to overcome. It's like you could sleep and sleep and sleep and you'd still be tired. So one of the things we want to consider with that is making it easy to have meals. Have convenient options at home. For example, if you want to use frozen or canned vegetables or canned fish, if those are foods that you eat, to choose options that are quick cook or ready to go can really save you time and energy. Another thing you can capitalize on is choosing takeout foods that you enjoy and tolerate, if you're able to have access to that, and using grocery and meal delivery services in your local neighborhood. Here at the Princess Margaret, we do have a program through our Elixir Kitchen that offers monthly demonstrations on different nutrition key points, and they're often very aware of choosing easy, convenient methods of cooking. So if you want to check that out, that'll be online.
Yeah, it's a fantastic resource.
Yeah. I just briefly want to touch on diarrhea. I know that can happen as well. The gut being a place that's quite impacted. If you're having lots of stools, make sure your team is aware. If you notice a trigger, be mindful of what that might be. For some people, it might be fiber foods, whole grains, lots of fruits and vegetables. For some people, it might be spicy foods. For some people, it might be fatty foods like fries or takeout. It's not that those foods are bad, it's just that they're triggering or making you have more loose stools. So if that's the case, you may want to hold off or slow down on them and focus in on other foods. I do want to emphasize now, I'm not going to talk so much about constipation, the other side of things, because all of the side effects that I've talked about earlier are also can be and would benefit from being managed with medications. Because there isn't really anything natural about being on treatment. It's not a natural thing. And so our body is not really geared to deal with it naturally. And so use the medications your team suggests, or discuss with them about your concerns about medications, or if the medications are not effective, to best get you those management so that you can actually work on getting the nutrition your body needs.
Yeah, makes sense. And so, apart from all of this, you talked about tailoring of a diet plan, what else can a dietitian offer to someone who is undergoing treatment for colorectal cancer?
So a dietitian can offer personalized suggestions to help you meet your nutritional needs and goals. We work together in collaboration with your team and yourself and your family and caregivers to come up with strategies that work with and around your nutrition impact symptoms, those side effects we talked about. And we consider, based on your cultural and personal food preferences, dietary allergies and restrictions, and social and financial situations. So a lot of things to bring together. If a dietitian notices that you're not able to meet your nutritional needs by eating and drinking, they can advocate on your behalf for other ways of getting you nutrition, and we call that nutrition support, whether that be feeding through a route like a feeding tube or through the IV. In an ideal world, all cancer patients and caregivers would benefit from being connected with a dietitian, whether for a few nutrition questions or for basic education and learning about where we can get trustworthy, reliable nutrition resources. Unfortunately, most oncology centers will not have the resources to do so. And if you are able and feel that you would like a nutrition or dietitian referral, it could take quite a bit of time because of wait times. I speak from personal experience, unfortunately. And so what I want to share today is knowing where to find reliable answers for your questions pertaining to nutrition, so that you're on track. And even if you do require extra support from a dietitian, you would already have some information while you're waiting to get there, waiting for that referral, for example. So we have Colorectal Cancer Canada as your resource, government-funded organizations like Canadian Cancer Society, BC Cancer, Cancer Care Ontario, Nourish Oncology Publications has resources created from dietitians, and even with specific to CRC diagnosis. Those would be some of the resources that will help you filter through maybe some messaging you're getting from, say, social media or while meeting friends and family that's a bit conflicting. And finally, if you do have uncertainty about your diet or drug-nutrient interactions, do speak with your oncology team. There's likely going to be different disciplines, nurses, social workers, pharmacists, who may have some understanding to answer your questions or be able to redirect you in the appropriate medium. I would say the ideal moment when you want to flag a referral for a dietitian, if you do notice you have weight loss greater than 2 pounds in a week or 2 pounds consistently over time. If you've had a history of 5 to 10% of unintended, you weren't trying to lose the weight, but you did, that would be another red flag. If at any point you have trouble with swallowing or eating and drinking enough, you notice you're eating half or less of what you used to, that would be another sign. And of course, if you have pain, oral pain, or any of the nutrition side effects that are affecting your eating, maybe the time to speak with your team about that, and they should actually absolutely be aware of what's going on there. And finally, if the doctor suggests a new diet, you would assume that you would get a referral, but it might be helpful to make sure you do get the appropriate information about your new diet to follow.
Great. Yeah, thank you. Super helpful. And then, so in terms of individuals who have completed treatment, they've done treatment, how or what are some long-term sort of dietary considerations that, people who have completed treatment, are in the survivorship phase, can take into their day-to-day?
Mm-hmm. So the guidelines for survivorship are quite similar to prevention. Of course, I do want to consider where the cancer site is. The gut may be affected. So your tolerance to certain foods or amounts of fiber, for example, might be different from before. So managing bowel movement regularity to ensure you're having not issues with constipation or diarrhea, but finding a balance that might be your new norm, and to ensure wellness. So when I speak more in particular and in terms of managing bowel movements, that might be a matter of, in part, changes to your diet if you've had to do that during treatment to manage side effects. That may continue or may not. And also using medications if your team has found that has been helpful for you as a regimen. So in terms of guidelines for cancer prevention, which also applies to cancer survivorship and preventing recurrence, I want to talk a little bit about processed meat. So that's different from just red meats in particular. The processed meats I'm talking about is anything that's cured or salted. So like, think hot dogs and sausages, deli meats, bacon. So because of the process those foods go through, they have actually been proven to have some carcinogenic effect in the gut when it's being digested. So the recommendations from the American Institute for Cancer Research is that we limit those to special occasions. If you're going out for a baseball game, have those hot dogs. If you're having a special brunch, enjoy the bacon. But try not to make that your regular part of your diet if that's possible. With regards to red meat, so I'm talking fresh meats from veal, lamb, beef, pork. The guidelines do allow quite a bit of permission for having those foods without having the associated risk. So the recommended intake per week for fresh red meats, and that's cooked fresh red meats, is 12 to 18 ounces in a week. So what that looks like is a single portion size is about the size of the palm of your hand. This is 3 ounces. So 12 to 16 a week would be about 4 to 6 times you could have a portion of red meat. So it's quite a lot. It's a lot more than what people tell me they're eating anyway. So we don't need to fear that. In terms of other balances in your diet, some of you may be familiar with Canada's Food Guide, which has a plate model and includes whole grains, if you're able to tolerate whole grains, but essentially carbohydrate foods like rice, pastas, bread, and if you choose the whole wheat option, that has more fiber. Fruits and vegetables, which makes up half of the plate, a variety of colors, and cooked or raw, up to you. And finally, lean proteins. So protein foods that I mentioned earlier would also be something you would keep incorporating to keep meeting those regular nutrition needs. As much as you can, try to choose foods that are not as processed. So if you can, limit the frozen like dinner entrees, and try to cook from home if you can, or have meal sources that are more freshly cooked. But if you're using convenience options that are more minimally processed, like such as frozen fruits and vegetables or canned fruits and vegetables, there are ways to incorporate those, and they are still as nutritious as you would get from fresh fruits and vegetables. I'm going to hit on a few other things that are not as related to food, but kind of work in conjunction. So maintaining a weight that's healthy for you, whether that's keeping it not too high or not too low, with your healthcare practitioners. Limiting alcohol, perhaps to social settings, 2 standard drinks per week that can look different, whether it's a beer or hard liquor. Keeping it to 2 or less per week can reduce your risk for cancer. And finally, my suggestion for enjoying and eating with others is having social time around the table. So making food a communal activity, which it was always meant to be. Cook together if that helps with your meal preparation. Eat together, grocery shop together. Enjoy what you eat and don't stress about every little bit. Like have that burger and milkshake if you want it. And I'm talking here a bit about risk, but risk does not equal cause. So just want to keep that in mind. And of course, there are a lot of other factors affecting how you eat and how well you eat and how much you're able to eat. And nutrition is really one of the aspects in your life of many. So I'll leave you with that.
Yeah, thank you so much, Carmen. That brings us to the end of the session. But thanks so much for joining us today and sharing your expertise. It was a very informative session. And just as a note to our audience as well, Carmen has sort of put together a PDF with some very helpful guiding information about a lot of what we covered today in our discussion. And that's available for you to have a look at and download right below the video player on your screen. So that brings us to the end. Thank you so much. And from here, we'll go right into the Q&A. Thanks everyone for sharing your questions. So Carmen, we'll jump right in. So first question, how can we use nutrition as a tool to reduce symptoms of LARS or general frequency or urgency of bowel movements?
Mhm. So when you have specific symptoms, such as with LARS, you do want to adjust it kind of based on what you're experiencing and not to limit foods um, that you think may be a cause, that foods that you've noticed have already been a trigger for certain of those symptoms. So with more looser bowel movements, it may mean choosing foods that are easier to digest, lower in the fiber. And so making sure vegetables are cooked and cooked soft, maybe easier to digest, peeling tough skins, and that goes for vegetables or fruits. Choosing the ones that tend to be a bit less abrasive in the gut without seeds, for instance, like uh, berries. They have a lot of seeds, so they can be a bit harder to digest or cause or be more of a trigger for loose stools. So avoiding things like berries, nuts and seeds, but really only avoiding things on and as as it's tolerated or not tolerated, as opposed to kind of cutting out whole food groups, assuming that they're an issue. Another thing that can be helpful is to eat smaller amounts at a time, so to give your gut a bit more leeway in terms of portion sizes, slower, like not having to digest as much at a time. And I'm sure there are other suggestions that I haven't covered, but there are resources online, whether it comes from Colorectal Cancer Canada or other reliable organizations, Canadian Cancer Society, anything that's a government funded or a well-known institution, hospital or whatnot, will provide reliable information speaking towards some of those questions.
Amazing, thank you. And so, what signs and symptoms should patients or caregivers look for to identify malnutrition as early as possible?
Mm-hmm. So once you're noticing changes to the eating pattern, whether there is a decrease in appetite, other symptoms that may be affecting someone eating enough, nausea, taste changes, um, changes to the bowel movements that in turn affect how much someone is eating. We're looking at someone eating 50%, so half or less than they used to. So if they're eating 50% or less of what they used to, you're likely not getting as much as, definitely not getting as much of the nutrition they were getting before, and certainly at higher risk of developing malnutrition over time. Definitely if there's unintended weight loss, so losing weight without trying to lose the weight, and seeing that it's 2 pounds a week or more, or just an ongoing weight loss, lower and lower weight. When we're not trying to lose the weight, when it's unintentional, often quite a bit of that comes from our muscle mass. And it's not extra fat, it's not excess fat. We don't want to be losing muscle. And so those would be some of the flags for malnutrition, changes to the eating pattern. One of the very easy tools that we use, that's more verified for people in a hospital, but the questions may still be relevant, is the Canadian Malnutrition Screening Tool, or the CNST nutrition screening tool. And it's 2 questions. It's whether you are eating less than you have been over the last 2 weeks, and whether your weight has changed over the last couple of months. And that can be enough to determine whether or not someone may be at higher risk of malnutrition, is if they answer both questions. Yes, I'm eating less than before, and I've had some weight loss over the past couple months.
Great, thank you. I have another question here that asks about nutrition after cancer care. So, this person says, basically after care, I'm left on my own to manage nutrition. Are there specific foods after treatment that should be avoided? Does cancer favor carbs or sugar, for example? There's so much info out there about what diet is best to follow.
So just to kind of answer the question, walking slightly backwards, there's a few components there. So just to say, there aren't certain foods that would be favorable to cancer or certain foods that would be harmful to cancer. And that applies at any stage in time of your cancer experience and the treatment. But there are some guidelines to kind of continue promoting those healthy eating lifestyle, and those guidelines can be found through the American Institute for Cancer Research, which is short, we call it ACRE. Those guidelines will talk about reducing processed meats. So I think I would have mentioned the bacon, hot dogs, deli meat, keeping those to more special occasions, and to opt for foods that are more like fresh meats. You're cooking like, instead of the processed version, red meat version, like if you're cooking, fresh minced meat, whether it's beef or pork, red meat would still be permissible. It would just be making sure you're not having more than those 4 to 6 portions a week. And then other considerations of moderate and managing amounts of processed foods and limiting sugar sweetened beverages, for example, would be some of those other guidelines. To be honest, the guidelines are not too different from Canada's Food Guide, which is the overall guidelines for our population, with some area of tweaking, depending on whether you're having symptoms or whether your team has advised you to follow a certain way of eating post-treatment. Otherwise, they are quite similar to the general population, which would include things about the red meat or the processed meats, or not overdoing it on sugary like sweetened beverages. And then I do want to do a little plug for the Elixir Kitchen. That's spelled ELLICSR. That's a program offered through the Princess Margaret, and it's accessible to anyone. There's no registration. They have a live stream offered once a month on the third Thursday, and they speak more to kind of those survivorship guidelines. I think they've hosted Colorectal Cancer Canada at some point. They'll talk about overall healthy eating patterns with some specific topics of interest from time to time. That might be a good touch point for ongoing nutrition, refreshing your understanding of nutrition, getting ideas, recipes with our wellness chef through the Elixir Kitchen program.
Yeah, we've definitely worked with them before. It's a wonderful resource for patients. So I think we have time for maybe one more question. So for folks who get a ostomy reversal, do you have any nutritional guidelines to help adjust or transition?
That's a slightly more specific question. So I would say first you'd refer to whatever your medical team, your surgeon, or even a dietitian who you may be referred to would recommend for you. Otherwise, for individuals who may be a bit more, I guess there aren't specific recommendations. Typically, patients that I see will still follow a lower fiber, those easier to digest fruits and vegetables and white grains for a little bit of time, maybe 4 to 6 weeks, depending on their symptoms, and then start to reintroduce some of the more regular diets. As long as the team is okay with it. And so what that can look like is to, if you've been restricting kind of the vegetable variety or the fruit variety you've been eating, start to incorporate those maybe in smaller amounts if you wanted to reincorporate them. Still cooking your vegetables, maybe choosing the other ones of all different varieties. And then reintroduce kind of whole wheat products as tolerated, brown bread, quinoa grains, slowly in smaller portions as tolerated, and then holding off on things that might be a bit harder to digest, like bran, whole nuts, and seeds until maybe a couple of weeks after, as you see fit and as you wish to try those foods again.
Amazing, thank you. So I think that brings us to the end of our Q&A session. Unfortunately, we do have some more questions in there, but we will save those and make sure that we answer those separately. after the conference. So thanks everyone for sharing all of your questions, and thank you, Carmen, for being here today.
Thanks, Sarah.